so we're gonna be doing tissue conditioner on the mandibular. I've already Vaselined up my model so that the material doesn't stick to that. You can see my consistency is pretty thick and stringy. And so I'm gonna scoop as much as I can over to the side of the cup and pour it out into the denture. I'm sorry, my hand is probably cutting across that video, but it is super difficult to make sure I'm not in the way. All right, trick for stringies is to kind of wrap it around your spatula and pull it up. You want the material to be around the vestibule area because it needs to fill in that space, especially if there's sores in that area, because remember, tissue conditioner is to heal the tissue that is in the mouth. Before I go to put this in the patient's mouth, I'm going to clean my spatula. Remember that I Vaseline the model so that nothing sticks. Vaseline is an inhibitor of all materials though, so you don't want to do too much, or our soft reline or our tissue conditioner will not set up. It's very important to not touch the teeth of the denture to the best you can. I'm going to line it up on the model, push down. I personally, I'm gonna flip it, like to push this way. I'm gonna take my pointer fingers and I'm gonna push down on the occlusal surfaces of the posterior teeth, equal pressure on both sides. This is kind of a reenactment of what the patient would be doing if they were biting down. Remember, if they have a maxillary denture, you do the mandibular first and keep the maxillary in place. All right, now we're going to just wait for the material to set up. Chelsea and I are the ones that will remove this. You can see right now that it is still shiny. We're gonna wait for it to become a little bit dull. We will be the ones that picks it up or picks it off the model. I'm gonna switch to one that we've pulled off earlier, and it's gonna look something like this. So you would pull it off, you would seat it back down onto the model, let it finishing setting up, but we need to remove the big chunks first. So you're gonna have scissors. Make sure that you're just removing the chunks, nothing on top of that border. I'm sticking to everything. Scalpels are sharp. You guys be careful. I just got a fresh one, that's why it cuts so well there. Pull that all off. After you remove the big chunks is then when you would seat it back into the patient's mouth. They would close down, let it finish setting up. It is really important that you guys actually pay attention to how I'm fulcruming right now. So my thumb is here. It acts as a guide and a stabilizer. As I'm using my scalpel, I'm going towards it, okay? Even if I was on this side, I would be doing the same motion, going towards. I always have a finger rest on the model itself or the denture to make sure that I don't slip or damage something on the denture that doesn't need to be damaged. You're always going to hold around the edges of the denture, not where the soft reline material is at, because your thumbprint, when the material is not fully set up, could actually end up being on the denture itself. They do make a chemical that can clean up all these little pieces on somebody's real denture, but we don't use that here. Just be careful, like how I just did that. I don't want you guys to accidentally hurt yourselves. So when you guys turn these in, you'll have all of this material gone off the edges. And then I'm going to show you what a really good, that's fantastic right there. All right. Sometimes we'll have air bubbles here, and that's from Chelsea and I pulling it off the model, and we're not going to dock you down on anything like that. The trick though is that you kept some tissue conditioner here on the border, just like you're supposed to. And then remember that tissue conditioner is to heal the tissue This was probably a mess up when we went and we seeded it and removed it off, but we've got a nice solid flow right around the edges, and you guys are just gonna clean it up and make sure that there's no pieces on it, such as you would never give this to a patient if there was a piece on their teeth. Then lastly, you would seed it in the patient's mouth, and then you would give them home care instructions, and that is tissue conditioner, placing it on the mandibular.